What if I told you surgeons can stop your heart completely and still bring you back to life? Red face for a few unbelievable hours, your body survives while a machine takes over the job of your beating heart and breathing lungs. This is not science fiction. This is real open heart surgery in 3D today. You'll witness the terrifying, fascinating, and life-saving procedure that thousands of people go through every single day. From cracking open the chest to restarting the heart, every second is a battle between life and death. And once you see what really happens inside the operating room, you'll never look at the human heart the same way again. Open heart surgery sounds terrifying, and honestly it should. Imagine lying on an operating table while a team of surgeons literally stops your heart to save your life. Yet every day, this incredible medical procedure gives people a second chance to live, breathe, and love again. In this 3D journey, you'll discover exactly what happens during open heart surgery, step by step. You'll see how surgeons open the chest, connect the body to life support machines, repair damaged arteries or valves, and somehow restart the human heart. It's intense, emotional, and absolutely mind-blowing, because this is modern medicine at its most extraordinary. Open heart surgery becomes necessary when the heart can no longer function properly on its own. The heart is responsible for pumping oxygen-rich blood throughout the entire body, but certain diseases and conditions can weaken this vital process and put a person's life at serious risk. One of the most common reasons is blocked coronary arteries. Over time, fat, cholesterol, and plaque build up inside blood vessels, reducing blood flow to the heart muscle. This can cause severe chest pain, shortness of breath, heart attacks, and permanent heart damage if left untreated. Surgeons may perform bypass surgery to create a new pathway for blood to reach the heart safely. Another major reason for open heart surgery is damaged heart valves. Valves control the direction of blood flow inside the heart, and when they become too narrow or start leaking, the heart must work much harder to pump blood. This extra strain can eventually lead to heart failure, extreme fatigue, dizziness, and dangerous irregular heart rhythms. In some cases, surgeons repair the valve, while in others they replace it completely with an artificial or biological valve. Open heart surgery is also performed to repair congenital heart defects that are present from birth. Some babies are born with holes in the heart or abnormal blood vessel connections that interfere with normal circulation. Surgeons may also operate to repair aneurysms, remove tumors, or implant life-saving medical devices that help the heart maintain a stable rhythm and stronger blood flow. Before surgeons can safely repair the heart, they often need to temporarily stop it from beating. A moving heart makes delicate surgical work extremely difficult because even the smallest movement can affect precision during procedures involving arteries, valves, or internal structures. To make this possible, doctors use a specialized system called the heart-lung machine. This machine takes over the work of both the heart and lungs by pumping oxygen-rich blood throughout the body while the heart remains still. Once the patient is fully anesthetized, surgeons open the chest and carefully access the heart. Large tubes called cannulas are inserted into major blood vessels to redirect blood away from the heart and into the heart-lung machine. Inside the machine, the blood receives oxygen and has carbon dioxide removed before being circulated back into the body. This process keeps vital organs like the brain and kidneys alive and functioning during surgery. After the machine is connected and stable, surgeons stop the heart using a very cold solution known as cardioplegia. This solution is injected directly into the coronary arteries and rapidly cools the heart muscle, causing it to stop beating while also protecting it from damage caused by lack of oxygen. Cooling the heart slows its energy use and reduces stress on the tissue during the operation. With the heart completely motionless and blood circulation controlled by the machine, surgeons gain a clear and stable environment to perform highly complex repairs with extreme accuracy and control inside one of the most important organs in the human body. The heart-lung machine is one of the most important inventions in modern medicine because it allows surgeons to perform operations that would otherwise be impossible. During open heart surgery, this machine temporarily takes over the functions of both the heart and the lungs, keeping the patient alive while the heart is stopped. Without it, blood would stop flowing to the brain and other organs within minutes. The machine works continuously throughout the procedure, delivering oxygen-rich blood to the body and removing carbon dioxide just like the lungs normally do. Blood leaves the body through large tubes connected to major veins and enters the machine's circulation system. Inside, the blood passes through an oxygenator, a special device that adds oxygen and removes waste gases. The machine also controls blood temperature, which is extremely important during surgery. Cooling the blood slightly can help protect organs and reduce the body's oxygen demands while surgeons work on the heart. Powerful pumps inside the machine maintain steady blood flow and blood pressure throughout the operation. A highly trained specialist called a perfusionist constantly monitors the machine, adjusting oxygen levels, pressure, temperature, and circulation in real time. Every heartbeat, oxygen level, and blood movement is carefully controlled to keep the body stable during the procedure. Even though the heart is completely motionless, the body continues receiving the oxygen and nutrients it needs because of this advanced technology. The heart-lung machine creates a controlled environment where surgeons can repair blocked arteries, replace damaged valves, correct defects, and perform highly detailed procedures that require total precision inside the chest cavity. Once the heart is safely stopped and the heart-lung machine is fully controlling circulation, surgeons begin the most critical phase of the operation. The chest has already been carefully opened through a procedure called a sternotomy, where the breastbone is split to provide full access to the heart. The surgical team works in a highly sterile environment, using specialized tools designed for extreme precision inside a very small and sensitive space. Every movement is slow, controlled, and calculated because even a minor mistake can affect life-saving outcomes. In 3D visualization of this stage, the heart appears motionless, almost like a paused engine, while tubes and sensors surround it to maintain life. Surgeons first inspect the heart visually and sometimes with imaging tools to fully understand the extent of damage. If the problem is blocked arteries, they locate the exact points where blood flow is restricted. In valve-related cases, they identify whether the valve is leaking, stiff, or completely non-functional. Each condition requires a different surgical approach, and decisions are made in real time inside the operating room. For bypass procedures, surgeons take a healthy blood vessel from another part of the body, often the leg or chest, and carefully attach it above and below the blockage. This creates a new route for blood to flow, restoring oxygen supply to the heart muscle. In valve repair or replacement, the damaged valve is either reshaped or removed and replaced with a mechanical or biological substitute. Every stitch is placed with extreme accuracy using ultrafine surgical thread. Throughout the process, the heart remains still, but the rest of the body is fully supported by machines. The surgical field is continuously irrigated and cleaned to maintain visibility. Surgeons work as a synchronized team, communicating every step clearly while focusing on restoring the heart's natural function. The environment is intense, silent, and deeply focused, where human skill and medical technology merge to repair one of the most complex organs in the body with extraordinary precision and control. Even though open heart surgery is one of the most advanced and carefully controlled procedures in modern medicine, it still carries significant risks and challenges that require extreme precision, preparation, and teamwork. Every patient who enters the operating room has a unique medical condition, and no two surgeries are ever exactly the same. This unpredictability is one of the biggest challenges surgeons face, because the heart is not just a mechanical pump but a living organ that reacts differently in every individual. One of the major risks during surgery is bleeding. Since the chest is opened and major blood vessels are being worked on, even a small tear or weak tissue can lead to significant blood loss. That is why constant monitoring and rapid response systems are always active in the operating room. Another critical challenge is the risk of infection, which can affect the heart, lungs, or surgical site if strict sterilization is not maintained at every stage of the procedure. There is also the risk of complications related to the heart-lung machine. Although it is designed to safely take over the body's circulation, long periods on the machine can sometimes affect blood cells, clotting systems, or organ function. Surgeons and perfusionists continuously adjust settings to minimize these effects while ensuring stable oxygen delivery throughout the body. Another serious concern is the brain's sensitivity to oxygen levels. Even though the machine supplies oxygen-rich blood, any slight imbalance in pressure or flow can potentially affect brain function. This is why monitoring equipment tracks brain activity, oxygen saturation, and vital signs in real time during surgery. After the surgical repair is completed, the heart must be carefully restarted. This moment itself carries risk, as the heart may not immediately regain a stable rhythm. Sometimes it needs electric shocks or medications to help it begin beating regularly again. Surgical team must remain fully prepared for sudden changes in heart rhythm or blood pressure during this critical phase. Beyond the technical risks, there's also the emotional weight carried by the surgical team. They are responsible for a life suspended between machines and skill, where every second matters and every decision can change the outcome completely. After the complex repairs inside the heart are completed, the final and one of the most critical stages begins, bringing the heart back to life. At this point, the heart has been still for a controlled period of time, protected by the heart-lung machine and cooled cardioplegic solution. Surgeons gradually prepare the heart for restart by restoring normal temperature and carefully reintroducing oxygenated blood back into the coronary arteries. This transition must be extremely controlled because the heart muscle is sensitive after being inactive and protected for so long. As blood flow is slowly redirected from the machine back into the heart, the surgical team closely monitors every change in rhythm, pressure, and electrical activity. Small electrical signals begin to reappear in the heart muscle, indicating that the natural pacemaker is starting to respond again. In many cases, the heart does not immediately start beating in a stable rhythm on its own. It may begin with weak or irregular contractions that require immediate medical support. To assist this process, doctors may use controlled electric shocks known as defibrillation. These shocks help reset the heart's electrical system and encourage it to resume a normal, coordinated beat. Medications may also be administered directly into the bloodstream to strengthen contractions and stabilize rhythm. The timing of every intervention is precise because the heart is in a highly sensitive recovery state. Once the heart begins beating again, surgeons slowly reduce dependence on the heart-lung machine. Blood flow is gradually rerouted back through the natural circulatory system, and the machine's support is decreased step by step. This process is carefully observed to ensure that the heart can handle the workload on its own without signs of failure or instability. Vital signs such as blood pressure, oxygen levels, and heart rhythm are continuously monitored during this transition. After full circulation is restored, the chest cavity is checked for bleeding, proper function, and stability of the repair work. Temporary packing wires may be attached to help control heart rhythm in the immediate recovery period. Once everything is confirmed stable, the sternum is carefully closed using strong surgical wires, and the outer layers of tissue and skin are stitched back together. Even after the surgery is complete, the journey is not over. The patient is moved to intensive care, where the heart is continuously monitored for hours or even days. The body slowly adjusts to normal circulation again, and the repaired heart begins its recovery process, supported by medications, oxygen therapy, and close medical supervision. Each heartbeat after surgery represents a delicate balance of surgical precision, advanced technology, and the body's natural ability to heal itself.